Right, everyone, welcome back to our part 3 of our strategic planning webinar series for Missouri Partners in Prevention. As it says on the screen, this third part, we're going to look a little bit more at data trends and strategies, but specifically looking and comparing your local data, or encouraging you to compare your local data to the state level data and the state strategies that they outline and support, that PIP outlines and supports. So with that, we're going to go ahead and check back in on our roadmap. As you can see, that very first on the left, we had our Prevention 101 webinar, followed by our Theory of Change webinar. Ideally, you have watched both of those and done the paused activities for both of those. Because today we're going to talk about, or in this webinar, we're going to talk about, as I mentioned, those trends and strategies and how your local data can ideally or possibly align with the state data and approach. And then once we get some of that alignment worked out, we're then going to talk in the next webinar about logic models and planning in a successful manner, realistic planning. So to jump right in, right here we've got this 50,000 foot view at the state level of what we're thinking about. There is a document that you should be able to access that is identified. There's a couple that is identified as going with this webinar, and we're going to look at it in a few minutes. But I do want to throw out a word of caution that at the time of this recording, this document is still under construction. It's a very exciting document, as you can see by all the confetti, but it is still in process, at least when this webinar was recorded. For those of you who were able to be with us in December's PIP meeting, December 2018, it was under construction then, but for those of you who may be watching this in the fall, maybe in August 2019, it is possible that that document may have been updated and finalized. So depending on when you're viewing it, yours may have some different items than what I'm going to share, but I will try to stay kind of in general in order to increase the shelf life of this webinar. So the document that you can download and access is a look at PIP's statewide benchmarks. Again, this is an initial look, at least as of this recording, and I will also throw it out for those of you who are there in December. You know this. It was drafted by me, Kathleen Ratcliff, and not necessarily the quote unquote powers that be at Partners in Prevention. So again, it may undergo some changes, but we looked at through discussions with Partners in Prevention staff, we looked at some of those big areas or big issues of concern, both that they see statewide and that they have grant funds to target. So with that discussion that we had 5 big statewide issues of concern. So this substance impaired driving, so this could be driving under the influence of alcohol, riding under the influence of alcohol, like riding with someone who is under the influence, driving after using marijuana or other, mind-altering substances, kind of in general wrapped together, substance impaired driving. We also had the issue of concern of binge drinking. And so for this, we used a couple of different data points, but the main one being the 5 or more drinks in a 2-hour period in the last 2 weeks. We also identified the issue of concern of underage drinking, so individuals consuming alcohol under the age of 21. Fourth, we identified the issue of norms misperception, so the frequent rate or the large number of students who believe that their peers are using either substances or using more frequently than they actually are. And then we also talked about the issue of suicide ideation, suicidal thoughts and actions, attempts, those types of things. So these 5 items are the big issues of concern for PIP at that kind of state level. Understanding that each campus may have different issues of concern. So you may have these same 5 things that you're wanting to target. You may have a couple of others outside of these 5, or you may not have one of these. It is also possible that You may have all 5 of these issues, but you may have some subpopulations that you're trying to focus on a little bit more, either because they're experiencing some of these issues or risk factors at a higher rate, or because that's where kind of the will on your campus is to pay a little bit additional attention to those subpopulations. So as an example, if you're looking at that document that you were able to download, you can see that we have those issues of concern outlined. And then we also have identified specifically which questions on the mock B we're paying attention to. If you have other data points outside of the mock B, you would be able to identify those there as well. And then we've set our baseline. So we've picked a year's worth of data. This, I believe, came from the 2018 mock B. And we've identified what that baseline number is for that specific question. So I don't have the benchmarks up on your screen that you can see, but I did identify a couple of those baselines. So for substance impaired driving, one of them that we identified as a baseline or a question of concern to monitor is the fact that 16% of our students statewide have driven after consuming alcohol. You can see for binge drinking, the item we identified is the fact that 25% of them reported binge drinking, and again, that's 5 or more drinks in a 2-hour period in the past 2 weeks. I didn't list all of the baselines there, but because there's quite a few, but you can see where that baseline is. And then the last aspect is that we identified what our goal is. So a lot of these, PIP has had some really strong success, so a lot of these may just be maintenance. I think 25%, a lot of us may be concerned that 25% of students have binge drank in the past 2 weeks. But if we look at the national average and we even look at where Missouri was 10 years ago, 25% is pretty good, right? Ideally, I think we all want it to go down, but I think at a minimum, none of us want it to go up. So when we think about those goals or that objective, where we're trying to get that target, it is okay to just identify as maintenance. So we want to maintain or decrease some of these items. And especially that's important when we think about prevention, because a lot of times when we're doing really good prevention, we're able to reduce those numbers, but we do kind of hit a plateau. And that's not to be unexpected. That just means that we need to keep working so that we can maintain it there. But there are likely plateaus that you'll hit and you just won't be able to break past those, which means you have to keep up the work to maintain where it is. So I want to go ahead and look at encouraging you to either utilize the same worksheet format or to download the template. I think it's as a PDF, so it may not be as useful, but think about your local benchmarks, or what could your local benchmarks be? You can do, again, this holistically right now, but at a minimum, I want you to think about those couple of data points that you pulled out in the first webinar and think about where do they fit within these. So if you picked out something related to alcohol, it probably fits in some of those first few. If your rate was underage drinking or binge drinking, that obviously fits in there. You could also think about creating another category if you needed to, in order to kind of encompass your specific data point. But the encouragement is to see if those data points that you identified match within these 5 sections. If you identified a key data point of a subpopulation, obviously that goes under the subpopulation area. But I want you to think about, where does your local data point fit within these, or does it? And then start to think about, what are those questions? What is that data that would back up your problem? And what then would be your benchmark? So again, if you're thinking about binge drinking, you can identify the specific question on the mock-B that you use to measure binge drinking, and then go ahead and jot down your actual benchmark percent. So where were you in 2018? And then what is your goal? Is it to decrease? Is it to maintain? Some of them you do want to increase. I mean, ideally, we would want to increase the number of students or the percent of students who are using a designated driver. So it doesn't always have to be a decrease. But what I would like you to do is go ahead and pause this webinar, get your couple of key data points under the correct kind of category, map out your question, map out your benchmark and your target. Again, if you want to do this holistically and think about your entire strategic plan and putting things in place, you can do that. But at a minimum, let's go ahead and get those couple of pieces in there. So go ahead and pause and do that. Right, and so once you've got that, give yourself a little bit of grace. Understand that this is under construction. Again, if the PIP staff changes their statewide benchmarks or changes some of their categories, that would obviously change yours. But the next step is to then think about what are those benchmarks and how do they, and those problem behaviors and the strategies you've chosen to kind of connect those, and then make sure that those are the best strategies. So there's a couple of different resources for identifying strong evidence-based strategies. We've talked about partners in prevention's overarching 4 strategies, and then we walked through the college aim, both in the first webinar. I do also want to put out another resource, the Suicide Prevention Resource Center, so the SPRC. These have, this is a listing, they have a registry of suicide prevention related strategies. So if you're thinking about that suicide ideation or help-seeking behaviors or some of that, you might be able to find those there more so than like the college aim, which is focused on alcohol only. Along with this, there are others out there. If you are interested in trying to find additional strategies that have an evidence of effectiveness, this is definitely something you could reach out to your PIP staff for and have them kind of support you in that process of identifying them. And another drafted resource that we have for you that you should be able to download is the strategy alignment document. And so this strategy alignment document identifies the existing strategies from Partners in Prevention or the college aim, or some of the college aim, looking mostly at the strategies that we know are being implemented in Missouri, and aligns those strategies the best that we can to those benchmarks that have been drafted. Which means that some of them may help you identify the alignment between your strategies and your benchmarks. However, one size does not fit all. So if you remember back in that second webinar, we talked about the theory of change and that strong and having strong strategy stories and having a strong logical connection between your problem behavior, the underlying factors, and your strategy. It's important to remember that depending on what your campus's underlying factors are, what those whys are for your campus, the strategies in this document may not actually align. So this is not a resource that you should copy and paste these strategies to your campus and be guaranteed to see changes that you want to see. It is possible that it'll happen, but it is better to actually think through it, think through what your problems are, what the factors are, and then pick out your evidence-based strategies, as we've talked about. So for instance, a possible alignment or a possible misalignment, the big category being norms misperception. So if we are trying to see movement in our norms misperception, some of the strategies that are listed on your strategy alignment include basics, norms clarification marketing, educational presentations or online education to clarify norms, personalized feedback intervention, or a multi-component education-focused program. So I want you to think, this being an online recorded webinar, we can't have much audience engagement, but I want you to pause, or I will pause, and think, what are some possible challenges with these strategies listed, these 5 strategies, in terms of alignment with norms misperception? Do they all seem to align in your head, or is there some misalignment there? Right, so to me, most of these seem to fit pretty well. I think that we could argue that if we have a norms misperception issue, that if we are marketing and doing some online education or educational presentations to clarify norms, we're probably targeting that norms misperception, right? However, if we think about that last one, that multi-component education-focused program, this is one that, depending on the content of it, it may or may not even discuss campus norms. So if it doesn't even discuss campus norms or try to have that norming alignment, it probably isn't going to change the norms on our campus. It's probably not going to address those misperceived norms. However, if it does, you probably have a decent alignment there. Another example, so if we're thinking about our big category or our issue of concern related to suicide ideation, so this being the percentage of students reporting having suicidal thoughts in the past year, you can see in your strategy alignment sheet, the strategies that we've identified is Ask, Listen, Refer, so PIP's ALR program. Question, Persuade, Refer, Gatekeeper training, so this is a little bit broader, it's a national program. We've got the Respond program out of Mizzou, Cognito, and then Assist, the Applied Suicide Intervention Skills Training. So again, with this one, think about the big issue of concern and then the strategies listed. Do you feel like they are well aligned, or do we have a misalignment? All right, so if you caught that there was a pretty big misalignment here, you're right. You either are very, very smart and caught it, or you were possibly at the December meeting and got a sneak peek into it. But here we have the issue with our big issue of concern, the suicide ideation, is a rate or frequency of students reporting having suicidal thoughts in the past year. However, each of the programs listed are strategies that focus on training individuals on how to interact with people who may be experiencing suicide ideation or a mental health crisis. These are focused on those gatekeepers, those kind of surrounding peers, not necessarily the individual who is experiencing the suicide ideation. So if we're trying to reduce the suicide ideation in our population, these programs will help those individuals get to the resources they need, but they may not actually reduce the actual ideation that is occurring. So we have a bit of a misalignment here, right? So if we changed our problem behavior or our area of focus, we would be able to have an alignment. So maybe instead of looking at our rate or frequency of students reporting having suicidal thoughts, maybe we look at the number of students or frequency percent of students who don't seek help for suicide ideation, who maybe have low confidence or skills in their ability to respond or to support someone who is experiencing suicide ideation, those types of things. If we focused on that, these strategies would fit perfectly. We may be able to even stretch it a little bit and identify our problem as the rate of suicide on campus or the incidence of suicide on campus. Because theoretically, if we trained enough people around our students, someone should notice and be able to assist that student in getting the supports that they need. However, this is again where we start to run into that importance of clarification of the problem, making sure that we're identifying our problem very clearly, identifying the data points that we're monitoring, and then double checking that theory between the strategy and the problem. If I train every single student in ALR, that's great, but that's not necessarily going to contribute to a direct decrease in ideation because people are trained. Again, it could contribute to an increase in counseling appointments for support because people recognize the signs, but recognizing the signs doesn't necessarily stop ideation. So again, here we've got a misalignment. So as we think through these, our theory of change and our alignment issues, we need to make sure that for your specific campus, that you're keeping in mind some of these challenges we've talked about in the past few webinars. So this encouragement or this need to dig deeper and look at what our actual local contexts and conditions are to identify some of those root causes in our community. And then making sure that we are addressing those root causes versus just hoping for the best. Ideally, we would use evidence-based or at least evidence-informed activities or strategies whenever possible. There are areas where there's not, where the research and the strategies, existing research and data on strategies hasn't caught up with the problems. So there are areas where it's hard to utilize an evidence-based strategy. However, at a minimum, we want to make sure that we're using evidence-informed or theory-informed or research-informed activities to address those issues. Despite me giving you or PIP giving you this strategy alignment tool and identifying these benchmarks, You shouldn't just pick from this list and hope for the best. So if you've identified binge drinking, you shouldn't just look at the strategy alignment, pick all of those strategies and implement and hope that it works. Again, we want to think about those local contexts and conditions. And also, as we start to look through this and ideally start to improve and make our strategic plans stronger and think about some of this alignment, it's important to make sure you give yourself grace and understand that PIP overall has come a really long way since it was formed. And so some of the things that you may look back at, a couple years ago and maybe cringe a little bit as to how misaligned they were, or maybe how well-intentioned but ineffective they were. Understand that you've moved forward and we're learning more and improving, and we need to keep pushing forward, understanding that we've already come a long way. Partners in Prevention is also embarking on this outcome project, which is something that I believe many of you have asked about or wanted for quite a while. So they're working on trying to showcase changes that campuses have seen in their data so far as they relate to the strategies that they've been implementing. So this is something that I would encourage you to check with the PIP staff to see where they are in updating and the progress of the project. But in giving yourself grace when you look back, I also encourage you to give them grace, right? So this is a very challenging project that they are starting on, because right now they're trying to look back and see which campuses have had strong changes in various problem behaviors because of the strategies they've been implementing. However, as you probably have found, most campuses, I would bet, didn't necessarily have a strong theory of change connecting their strategies to their problem behaviors. And so therefore, it is even harder to identify that those outcomes happened because of that specific strategy. Just like with the college aim, where it's hard to identify those environmental strategies and what impact they've had, it is also hard to look back and say, this campus has had really great results in reducing their problem behaviors, but we don't know what strategy it is. That's very easy to happen. So when PIP started, their first goal was to get campuses talking and using a strategic plan and having those. Now, then they moved to making those strategic plans data-driven and focusing on best practices in terms of strategies. And so now we're setting ourselves up for success in the future in order of looking at our strategies, making sure they have a strong alignment with our problem behaviors so that we can actually map these outcomes moving forward. All right, so in this webinar, we've identified that kind of those statewide benchmarks and baselines, including the state's prioritized areas and those corresponding questions. Ideally, you completed your worksheet and were given time to look at how at least your key data points that we've worked with so far relate to these benchmarks. But ideally, you're taking this information, working it through the process, and doing it for every key data point that you all are prioritizing. So again, you can pull those from past strategic plans or from a brainstorming session with your coalition. And again, as you do this, remember to think about that prioritization slide in that first webinar. How do we look at our data and our priorities compared to PIP or to PIP's benchmarks? How does it relate to other campuses? So again, either getting some peer institutions or looking that way. Thinking about how do your strategies align? And are they strong alignments? Do they align with what PIP has identified in their alignments, or is it different? It's okay to be different. And then thinking about, again, what is your theory of change? Does it make sense to implement a given strategy to address the underlying factors related to the problem behaviors that you're trying to change? So thinking through these things, asking this is something that I'd encourage you to do both in a team at your campus, if you've got an office team, if you've got a campus coalition, even better to think through that. But if all else fails, if you're one of those solo people on your campus, unfortunately we exist, right? If you are the only person doing prevention or the only individual you feel like at your campus has a grasp on what's going on, this is a great time to reach out to the PIP staff and have this conversation with them. Working through this information, again, you can utilize 2018 data to work through this information as you're starting to build and improve your strategic plan moving forward. That is what they are there for. All right, so this is wrapping up our third webinar, looking at looking at your local data and how your local data and your strategies map up to the state level, trying to align those aspects. And so the next step is to take all of this information and put it into a logic model and get some planning aspects put together. All of that we'll cover in our next webinar.